Lesser-known breast cancer warning signs that majority of women don't know about. Nearly every woman knows that a worrying lump could be a telltale sign of breast cancer, but less than 50% are aware of the other warnings which could lead to a critical early diagnosis. October is Breast Cancer Awareness Month, and stats show that around 1 in 7 women will be diagnosed with the deadly disease during their lifetime. While most that are struck down with it are over the age of 50, it can also affect younger women, and it is not the only concerning fact. Less than half of adult women know about the lesser-known symptoms that don't involve the discovery of lumps. According to a new survey of 1,000 adults, there's a concerning gap in knowledge, so here are some of the things you need to look out for. It shows that, worryingly, only a third of women were aware that an inverted, retracted or downward-pointing nipple could be a sign of breast cancer. Around half knew a loss of feeling in the breasts was another, while just 51% through nipple discharge was nothing to worry about. A thickening of the skin on the breast is also something to be checked out, medics say, as is break puckering, an indentation that appears when you raise your arms. Lead researcher Professor Ashley Pariser spoke about the importance of speed after releasing the study, which also included feedback from men. Screening mammography is our #1 defense in detecting and addressing breast cancers at their earliest, most treatable stages, he said. It is also very important for people to be familiar with the look and feel of their own breast tissue so that subtle changes can be evaluated quickly to give us the best chance at early detection. We want people to feel empowered about their bodies and know what is normal for them. Many breast changes are the result of aging and childbirth. However, breast cancer can present in a number of ways. It is important that people feel safe to address these concerns in a timely way with their doctor. We have made great strides in detecting breast cancers in far earlier, more treatable stages. The lesser-known signs: retracted, inverted or downward-pointing nipple, breast puckering, loss of feeling in part of the breast, pitting, thickening of the skin on the breast, nipple discharge. Who is most likely to get breast cancer? There are increased risks if you have a family history of breast cancer, says Dr. Patel. The older you are, the more likely you are to be diagnosed with it. If you've had breast cancer before, or if you've had a non-cancerous or benign lump before, that can increase the risk, as well as if you're tall, overweight or obese, or if you drink alcohol, she explains. How can you mitigate risks? The biggest thing that people could do is try and maintain a good weight for them and exercise, not to drink alcohol, or drink the minimum amount of alcohol, and look at their fat intake, says Dr. Patel. Regular exercise and eating well can reduce your risk of breast cancer by as much as a third, and if you do have cancer, and you exercise regularly and eat well, that it can improve your outcome as well. Dr. Patel also explains, the breast cancer risk increases with age. So women who are between 50 to 70 years old, are invited for breast cancer screening every 3 years. If you do get an invite to go for screening, please go.